Okay, so 5 tips to prevent employee snooping. So this is a really big issue in healthcare generally, is that we've got more and more instances of employee snooping that we need to monitor and to be able to prevent. So we need to create that culture in your organization that snooping is not acceptable. It is a privacy breach, and I want to share some tips with you to help prevent employee snooping so that these situations don't occur in your organization.
You are listening to Practice Management Nuggets podcasts. Tips to help you start, grow, and improve your healthcare practice and your career. I help you manage the pink elephant in the room. Get the show notes from our website at practicemanagementnuggets.live.
We know that privacy is an individual's right to decide if and how they are going to share their personal information with someone else. As healthcare providers, we know that we do not look at patients' health information unless it is necessary for us to do your job, to provide the patient with a health service. Now, a privacy breach occurs when someone accesses, uses, or simply views personal information without having a need to know the information to do their job. Snooping is a common example of a privacy breach. Human curiosity, interpersonal conflicts, shaming, or bullying for financial gains are common motivators for snooping. We seem to be hardwired to want to peek into someone else's personal and private information. But snooping is a violation of trust between our patients and the healthcare providers and the people who work for them. We want our patients to trust us. We need the patients to share their personal information with us so that we can provide the appropriate health services to them. When healthcare providers and employees snoop in our patients' information, we destroy that trust with the patient. When one of our team members is snooping, it harms the effectiveness of our teams and damages the morale in the clinic. Snooping, even when it is just looking at personal information without a need to know to do your job, is a privacy breach. And snooping is illegal. A privacy breach can cost the clinic time and money to notify affected patients and to complete mandatory notification to the regulators. When there is an offense under the privacy legislation, like the Health Information Act in Alberta, there may be an investigation, charges, and court appearances, fines, penalties, and loss of employment. But it doesn't have to be this way. Let's look at the 5 proactive steps that you can take today to prevent employee snooping. The first step to prevent employee snooping is to be a privacy champion. Make sure that you understand the legal and regulatory obligations about privacy and how it affects your healthcare practice and your patients is an important step. Make sure that you name a privacy officer. By default, in Alberta, the custodian or the healthcare provider is the privacy officer, but the custodian can also name someone else, known as a responsible affiliate, to be the privacy officer for the organization. The Health Information Act requires custodians to identify that contact person. Just having a contact person, that privacy officer in your organization, someone who's assuming the responsibility to make sure that these things get done, will find that they are less likely to have a privacy breach. And if they do have a privacy breach, are able to mitigate that privacy breach more quickly than an organization that does not have a named privacy officer. The privacy officer should be in communication with both management and planning decision makers and the frontline staff who collect, use, disclose, and provide access to personal health information. We know that the privacy officer is responsible for accountability and management, including ensuring that health information management policies and procedures are developed and maintained as necessary. Being a privacy champion also means that you have policies and procedures in your organization. The steps that we do to collect, use, and disclose information and to ensure that patients have the right to access their personal information should be built into your policies and procedures. Having written policies and procedures makes it an efficient practice for you to follow those policies and procedures so that you don't have to rethink and redo on the fly. When you build privacy into everything you do, it certainly makes it much easier to be a privacy champion in your organization. Step two to prevent employees from snooping is to train them. We want to make sure that employees are aware about new trends in technology and information sharing so that they can make the appropriate decisions when they are at work at the clinic. So, the types of things that we want to make sure that employees are receiving training in is about privacy awareness orientation. Now, when the new employee comes to your organization, whether or not they've worked in a healthcare setting before, or they're a healthcare provider or maybe a new grad, or maybe this is the first time that they've ever worked in a healthcare practice, but maybe they're not even doing a healthcare job. Maybe they're bookkeeping or janitor. They still need to have privacy awareness orientation. And it's really important that the healthcare practice understands and provides a regular privacy awareness training to all of their employees so that they know for sure that it was done when they started to work in your healthcare practice. Now, orientation is important, but we need to make sure that we do the training throughout the year as well. So, as an employee takes on new technology or new roles in their position in the organization, they should be taking technology specific training or training specific to that new role. We also want general reminders throughout the year, and this absolutely can be fun. So, having quizzes or contests or sharing information from newsletters that you've received from information managers or newsletters that you see on social media, learning from those bad things that's happened about privacy breaches from other organizations, even cartoons and memes help to keep privacy and security top of mind throughout the year. Whenever there's a change in responsibilities or technology, you should be going back to review those policies and procedures and making sure that the training is up to date and current with those new changes as well. Remember, we need to train patients too. We need to take the time to explain to them about how their information is going to be collected, used, and disclosed, and who else should have access to their information. We also have a responsibility to make sure that patients realize that when we hand them a copy of their lab test or the consultant's reports or even their lab requisition, that the information on this piece of paper is important. They need to keep it safe. So we can help by demonstrating a good practice to our patients by providing patients with envelopes to keep that patient information safe and secure, putting that confidential stamp on them and letting them know how they can access the information when they've got questions are other key ways that we provide training about privacy to our patients. Step three to prevent employee snooping is making sure that we have reasonable safeguards in place. Reasonable safeguards make it easier for people to do the right things and avoid the temptation of snooping. There are three types of safeguards: administrative safeguards, which includes things that are in writing, your policies, procedures, training, oath of confidentiality. These are good examples about administrative safeguards. Technical safeguards. This often includes security related to computers. For example, making sure that we have role-based access to systems and PHI supports the need to know principle. Computer networks and electronic medical record systems that have user management audit logging and enforce unique user ID are other examples about technical safeguards. Technical safeguards also includes other non-computer systems like phone systems, security cameras, and more. Physical safeguards. These include the restricted access to paper records, ensuring that documents are shredded appropriately and that the doors are locked and the keys are managed so that duplicate keys are not made and are returned when employees leave the practice, are all examples of physical safeguards. Step four to prevent snooping is to monitor. Knowing that your supervisor, your coworker, or privacy officer is observing your interactions with personal health information may help to deter employees from snooping. Monitor audit logs to search for unusual activities or proactive review of users looking up patient information with the same last name or access to VIP records. You can also monitor by conducting regular monthly privacy and security audits, which will help to ensure that privacy training is understood and implemented appropriately. When you conduct regular monthly privacy and security audits, and where necessary, that corrective actions or training can also be implemented. Well documented and implemented consequences is step 5 to prevent snooping incidents. Written sanctions and discipline policies are required as both a deterrent to snooping and to facilitate the quick response to a privacy incident. When proactive measures fail, consequences may be appropriate. The consequences need to be reasonable, consistent across all providers and employees, and fair to the circumstances. Consequences may include written warning, retraining, and reprimands or disciplinary action. It may include firing employees and providing mandatory privacy breach notification if and when employees are caught snooping. Snooping is a privacy breach, and it will require investigation and reporting. Your written privacy breach policies, procedures, and forms will help you to respond quickly to a snooping incident. Sanctions might also be applied outside of the organization. When a privacy breach is reported to the Office of the Information and Privacy Commissioner, or the OIPC, or a privacy complaint is made to the OIPC, charges may be laid under the provincial privacy legislation. In Alberta, here's an example about a privacy breach charge under the Health Information Act. You can use this privacy breach example as a part of your training to inform employees about the consequences of snooping. So this is what happened. A clinic recognized that one of their employees viewed health records of close acquaintances, friends, and other people in the community. She did not have a need to know this information to do her job. In one case, the employee further disclosed the individual's health information to a friend. In June 2018, a medical clinic in Alberta reported the privacy breach to the Alberta Office of the Information and Privacy Commissioner. The OIPC opened an investigation and subsequently referred its findings to the Specialized Prosecution Branch of Alberta Justice. Charges of an offense under the Health Information Act were laid. In the court on September 2nd, 2020, the former clinic employee pled guilty in court to breaching the Health Information Act. We know it's an offense under the HIA to knowingly gain or attempt to gain access to health information. The judge sentenced the employee to a $6,000 fine and 3 years probation and 180 hours of community service. This example of a privacy breach and the charges of the Health Information Act serves to demonstrate the consequences and the importance and seriousness of employee snooping in health records. When you take these 5 proactive steps to prevent employee snooping, you will continue to build a bond of trust with your patients and clients. You will create a common respect among your team members for the importance of privacy, confidentiality, and security of personal information. When everyone is working collaboratively, you build efficiencies in your practice and save time and money. Demonstrate that you are a privacy champion. Download the Practice Management Success Tip, 5 steps to prevent employees snooping, and implement these proactive steps in your healthcare practice.
I'm excited about this new season, and I'd so appreciate your help to spread the word with your colleagues. First, make sure that you subscribe and add a review on whatever podcast platform that you use. Next, take a screenshot of this episode that you're listening to right now and share it on your Facebook, Twitter, LinkedIn, or your preferred social media channel. Remember to tag me and I will reshare your post. When you share the show, it makes it easier for people just like you and who like what you like to find the show. Until next time, this is Jean Eaton, your practice management mentor and your practical privacy coach.